Post-operative instructions, dental implants. This page will cover important information regarding proper post-surgical care for dental implants. It is imperative that you follow the instructions listed below carefully to maximize your healing and improve the long-term outcome of your dental implant surgery. Do not disturb the wound. Avoid spitting or touching the wound for a few days after surgery. There may be a metal stump slightly protruding through the gum tissue. Some mild bleeding or oozing is normal for 24 hours. You can control excessive bleeding, where your mouth fills up rapidly with blood, by biting on a gauze pad placed directly on the bleeding wound for 30 to 45 minutes. If the bleeding continues, please call the office for further instructions. Swelling is a normal occurrence after surgery. To minimize swelling, apply an ice pack or a plastic bag or towel filled with ice on the cheek in the area of the surgery. Apply the ice off and on as much as possible for the first 24 hours. Drink plenty of fluids. Soft food and liquids can be consumed on the day of your surgery. You may gradually return to a normal diet as tolerated 3 to 5 days after surgery, unless otherwise directed. Warm saltwater rinses can be made by mixing a half teaspoon of salt in a cup of warm water and should be used at least 3 to 4 times a day, especially after meals. If you were given a prescription mouth rinse, such as Paradex chlorhexidine, use it as directed in addition to the salt water. Brushing your teeth is important to decrease the risk of infection. Be very careful with brushing around the surgical sites until the gum tissue is fully healed. Once the gum is healed, you can brush the metal cylinder like a normal tooth. Keep physical activities to a minimum for a few days following the surgery. Avoid bending over, heavy lifting, or strain. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise.